Hi dear students, welcome to the class of Kidscovery. Myself Dr. Parv. We are in the class of pediatric infectious diseases and let's understand about a long question for university, a very important topic for your competitive exam and of course the Viva voice, that is called as pertussis. Now what is pertussis? Pertussis is a disease which is caused by Bordetella pertussis and it is responsible for the respiratory infection. So Bordetella pertussis is responsible for the respiratory infection and it is characterized by a very important word that is called as whooping cough. So like all the respiratory diseases, this disease is also going to get transmitted by aerosolized respiratory droplets which are going to get spread. After that you have got reservoirs. So of course the adolescent and adults whose vaccine induced immunity has weaned and major reserves for pertussis transmission to the major reserves. Okay, so adolescents and adults. So you very well know there is something which is called as DPT. NP is pertussis. So this is the vaccination which we give to the babies. In the baby time, and in adolescent and adults who are whose response to the immunity is lost, they are a major cause of infection. Remember pertussis. So if you see PER, 3 words, 5 words and 8 words. So basically 7 to 10 days, or you can remember 8 days is the incubation period for pertussis. The risk factor is for less than 1 year of age. They have got high incidence of pertussis, and fatal one is there in the 4 to 6 months of the children. What is the clinical presentation? See, these children are going to have 3 clinical stages. One is going to be catarrhal stage. So catarrhal stage is the initial 1 to 2 weeks. So what is going to be there? There will be upper respiratory infections which is going to be there, and of course low grade fever. Then comes the paroxysmal state, that is paroxysmal state. So paroxysmal state is going to have what? It is going to have cough, it is going to have inspiratory whoop, and there will be post-tussive vomiting. So these are, this is the intensity of this disease, that the child will, of course, child is going to cough, the child will have like this inspiratory woof, and the child is going to have a post-tussive, like after the cough, vomiting can even occur. So child will okay, so this is my way to remember that and I have shared it with you. Okay, so the child is coughing, the child is whooping, the child is going to vomit. So this is the paroxysmal stage, and after that there's a convalescent stage also. That means there will be resolution of the cough that is going to happen. Now infant presentation, I have told you, like infants, there will be, of course, there will be apnea that can be there. Why? Because there is a breathing difficulty. So infants, specifically less than 4 to 6 months, they'll have apneic episodes which can even present with cyanosis. They'll have cough, whoop can be absent in them. They'll be having relative bradycardia as well as encephalopathy. So please take care of the infants. So E for encephalopathy, R for relative bradycardia, A for apnea with cyanosis, and then cough without whoop. Coming on to the status of vaccination, see, please understand, like vaccinated children have less severe course of infection, okay, and as per CDC guidelines, a purely clinically diagnosis of pertussis can be made if the cough is more than 2 weeks and at least one of the following, like cough paroxysms, then inspiratory whoop, post-tussive vomiting, apnea, cyanosis. This is only for infants less than 1 year. So what is important in all these things? Just remember that this pertussis, understand, this pertussis is going to have a clinical diagnosis if there is inspiratory whoop, if there is vomiting, if there is apnea, there is cyanosis, all these things present. So how to microbiologically say that this is a whooping disease? So we have to do PCR, we have to do culture of mostly the nasopharyngeal secretions, and this is a gram-negative Coccobacillus. Okay, there is a gram-negative Coccobacillus. Okay, this is going to be what? This is going to be a gram-negative Coccobacillus which is going to be there. Okay, gram-negative Coccobacillus. So you have to remember this. Now pertussis toxin, what is going to do? So remember, pertussis toxins are going to have lymphocytosis, are going to have hypoglycemia. Okay, how it is going to act? By increasing the cyclic AMP. See, this is the domain mostly for the people of microbiology, but still I teach it. Like it is going to have hypoglycemia, it's going to have lymphocytosis. So Why I teach always this? Because whenever you will see Bordetella, right? Whenever you will see Bordetella, you will come to have increase in the WBCs, and in WBCs mostly lymphocytes are going to be increased, unlike the other bacterial infections where we actually see what? Where we actually see the neutrophils to increase. And of course there is one thing which is going to get decreased, that is called as glucose. So there is glucose decrease, there is hypoglycemia which is going to happen. What are the blood findings? I have told you lymphocytosis, that's going to be there. Okay, and what is the treatment? So see, macrolides are the first line of antibiotics which we choose for the Bordetella pertussis, and these agents, the macrolides, they are given to decrease their pertussis transmission, and azithromycin is something which is preferred in neonates. Okay, so these are the two things which you have to understand for your macrolides, for your pertussis. So P for pertussis, so you can remember from Papa, and M and A, M for macrolides and A for what? A for azithral or azithromycin, for the mnemonic is MA. So macrolide, please understand, yes, we have discussed in the previous recent videos only that erythromycin has got a very high risk for developing CHPS, that is congenital hypertrophic pyloric stenosis. So hypertrophic pyloric stenosis should be evaluated in infants less than 1 month of age, because erythromycin can cause that. So alternative drug is actually TMP SMX, that is sulfamethoxazole. So these are important for the patients who are like more than 2 months. So I just teach like this, 2 tablets, and of course more than 2 months is the time. The problem is that in infants who are less than 2 months old, this tablet can displace bilirubin from the plasma albumin. That's why they are responsible for causing the kernicterus, and that's why we always try to avoid this TMP SMX. Okay, we just try and avoid this cotrimoxazole, okay, because they are having highest risk of causing the kernicterus. So this is how the whooping cough happens. This is how the whooping cough occurs. Okay, Bordetella pertussis, I have told you, like stage 1 is going to have runny nose, stage 2 is going to have even the whoop sound, the vomiting, and in the end there can be like recovery, but recovery is actually slow. Chemoprophylaxis, I have told you already, like macrolides can be given, administered to all the household members also, and droplet precautions, yes, of course they have to be taken care whenever we are giving the prophylaxis for pertussis. So thank you so much. This was a small video, important video, where we have covered the entire of your long question of pertussis. Just jate, I want to ask you this question, that what is the culture media? What is the culture media for Bordetella? Okay, what is the culture media for Bordetella pertussis? Thank you so much. God bless you.